Stop throwing money at healthcare providers to fix your back. Billions of dollars are spent on injections, imaging, and surgery every year to manage low back pain. But despite throwing money at the issue, patients are no better off than they were a few decades ago. There are more people with chronic low back pain now than ever before, and patient outcomes haven't seen any notable improvements. And despite the clear evidence that exercise is beneficial for those with low back pain, the number of referrals to physical therapy hasn't changed. This is despite more people going to the doctor about their back. So be your own advocate and take control of your care. If you have low back pain, tell your doctor you want to go to physical therapy, or simply make the call yourself. What if I told you if you're over 30, you likely have a bulging disc? And if you're over 50, you likely have signs of spinal arthritis. But does it really matter? And the answer is, not really. People can have these changes and not feel a thing. And this is important to realize because imaging modalities such as X-rays and MRIs often give us false positive and false negative results. Despite the lack of reliability, they are often overutilized in those with low back pain. This is despite being well known that imaging for low back pain provides minimal value, offering no new findings or altering outcomes. So here's the takeaway. Low back pain sucks, but you don't need to take a picture of it. For most people, a structured exercise program and some time is just what you need to get back to the things you love. Are you doomed for a lifetime of low back pain? The short answer is, likely not. But let's look at the statistics to tell us more. Around 40% of people with acute low back pain become pain-free, and 55% report no disability at 6 weeks. This gets even better with time, with 72% being pain-free and 83% with no disability at the end of 1 year. Because low back pain is usually not an indicator of severe injury, most can return to work before pain is completely gone. But it should be known that acute low back pain has a relatively high recurrence rate, ranging from 66 to 84% within 3 years. Within the initial 3 months, the recurrence rate can exceed 10%. So unfortunately, your pain may return, but that does not mean you're broken. It's just the nature of back pain, which is why you should see a physical therapist to develop effective symptom management strategies in cases where those symptoms do decide to come back, so you can navigate and manage potential recurrences effectively. What's the better path, surgery or physical therapy? Well, in the majority of cases, the long-term outcomes of pain reduction and functional improvement are the same. But despite the equal results, a significant number of people opt for surgery, often unaware of the substantial risks it carries and neglecting the equally valuable outcomes achievable through physical therapy. And it's not to the fault of the patient. Our healthcare system over the decades has often pushed individuals with low back pain towards surgical and pharmacological interventions, despite their serious risks and lack of clear benefit over less risky options. So it's time to rethink the approach to low back pain and prioritize safer alternatives that have significantly greater impact on overall health and well-being.